So I hope many of you had the chance to enjoy Santa Fe last week at the ANCOR National Meeting. I know those of us that were there certainly benefited hugely, not only from the content, but what a unique little town. And with that, Donna, I'll hand it off to you to kick us off here. So thank you for joining us.
Great, thank you. Thanks so much, Bob. Good afternoon. My name is Donna Martin. I am the Vice President for State Partnerships and Innovation at ANCOR. I want to welcome you to today's discussion where you'll learn why being a data-driven provider is important. And you will hear lessons learned from providers on their journeys to becoming data-driven organizations. I'd also like to thank the BI Collaborative for leading today's webinar. They are an ANCOR National Gold Partner, and their Chief Growth Officer, Bob Hitson, will be facilitating our panel today.
Thank you, Donna. For those of you who may not know the BI Collaborative, we only work with human service providers, so we live the industry challenges daily through our clients. We help providers become improved data-driven organizations by pulling data from disparate systems to create a single source of truth of performance reporting in our business intelligence reporting platform. And we also address key success factors like data governance, data literacy, change management to optimize the adoption and the cultural change. So the question you may be asking is, why become a data-driven organization? And the reasons for becoming data-driven are well documented by some well-known global research firms. So 30% more likely to reach goals, more profitable, and then way more compliant with regulations. But being data-driven is also essential to compete as the market shifts towards managed care, value-based reimbursement, or alternative payment methods, whichever you may want to call them or be experiencing. So Donna, it's great to have you here today. Can you share insights that ANCOR sees related to these national trends?
Yes, certainly I'd be happy to. So as Bob said, it's important for a lot of reasons for organizations to have really solid data systems. It informs almost every decision that a service provider organization will make. Just to sort of level set here, I want to draw a couple of distinctions around managed care and managed long-term supports and services. This slide that you're looking at of the US depicts the states as of 2019, depicts the states that have some form of Medicaid managed care. The important thing to note here, though, is in these examples, the managed care is strictly for the healthcare components of Medicaid. And that differs certainly from the long-term supports and services. Bob, if you could go to the next slide. This slide shows the states with some form of managed LTSS, but the thing that it doesn't quite delineate is the fact that managed LTSS can occur in services for elders, elder care services, behavioral health services, and then certainly some states with IDD services. This particular map is reflective of just of those states that have it in elder care or behavioral health services. So you can see it's not as expansive as healthcare, managed care, but it is growing. And Bob, if you go to the next slide. This slide in particular focuses on the states that have a managed long-term supports and services for the IDD population. If you compare this to the two previous slides, you can see it's a much more limited number of states that have managed LTSS for IDD populations. But the thing that's really important to note here, and what I hope you all sort of take away from today's conversation, is that these states are growing in number. When I started with ANCOR about 5 years ago, there were maybe 40 to 50% fewer states with a managed IDD program. The states in orange are those states that currently have an active managed LTSS initiative, and the yellow states, Minnesota, Ohio, and Florida, have a a state leadership that is actively pursuing or considering managed LTSS. And in fact, I did this slide a couple months ago because Florida should now be an orange state. They have an active pilot that is looking at managed care for IDD services. So the point we make here is that this is coming. If it's not in your state or in your backyard at this point, it's likely to be in the not too distant future. And so that really kind of ramps up the importance and the need for data-driven decision making and using that data to really sort of measure and track your quality outcomes. And I think that's what the folks on the panel are going to talk about today.
That's
Bob?
great. Thanks, Donna. Yeah, I know we had the chance to go at the end of last year to NASD, which is the National Conference of the State Executive Directors. And, if you look at these states, they all looked back at each other as the next one came on board. And just for some context, even for today, Pennsylvania is now the next leader of the new innovative, let's say, performance-based contract. And fortunately today, we've got a distinguished panel, and they represent some providers from Pennsylvania that are going to be leaping into this new reimbursement model in January. So we've got Gian Janes. He's CEO from Valley Community Services. Jody Esper, CFO from Mainstay, and also CEO of Entrust Services. And then our own Scott Bachik, CEO and founder of the BI Collaborative. And Scott, to that end, you work with 30 plus providers in Pennsylvania alone. So can you quickly summarize for our audience PA performance contracting, which is scheduled to go live in January of 2025?
Yeah, so if you want the abbreviated version, Bob, mayhem, right? So everybody's scrambling. So if you watch that Allstate commercial there, that's the short of it. When you look at the performance areas, some of these are still not completely defined. There are a number of them there. If you come down from the top, it's looking at things like continuum services and what do you have in place for the transition of cares from dependence to independence of individuals. And then the second part, we look at the next three bullets, talks about staffing models. The state in Pennsylvania did a survey of providers to understand their staffing mix. Then you get into things like supporting medical needs, referral and discharge practices. I can tell you that one has people scared because it's looking at a target of within 90 days of the referral are people receiving services. And then again, integration of behavior support and the staffing mix associated with that. And then as you get into the bottom pieces, it's looking at, and it's referenced several times throughout the document in Pennsylvania, of how do you using data to drive quality improvement. So it's not only just having data in place, it's actually using the data. It's talking about data management within quality management activities and having an EHR. It's looking at risk management for incident and HRST. And I don't, if you're familiar with HRST, it's a predictive tool to understand the fatal five. Then it gets into some more outcomes-based measures. So employment outcomes, what percentage of individuals are employed? The next one looks at what are you using technology for within residential homes? And this in Pennsylvania is for IDD residential predominantly. And then it gets again into workforce quality and administrative pieces. In this piece, Bob, the providers we put into 4 tiers, and as you get to the top tier, you'll be eligible for pay for performance methods on top of that. So people are scrambling right now to put this in place. You can see in the date of the kind of the visual on the left, it was the first communication came out April, about a year ago. And it's projected to go live January 2025. So people are scrambling to put things in place. And so we'll see how it unfolds. But, we talk about data driven. If you had the infrastructure in place, it would be an easy reaction versus putting things together from scratch.
That's awesome. So Gian and Jody, you guys are leaders, right, in organizations that deliver services in PA. So, how's this impacting providers as you plan for the future? Jody, you want to start?
Sure. For us at Mainstay, being a data-driven organization, we were actively working on many of these items on this list of performance areas. The difficulty is that our timeline just got really short. And so we've had to conduct an internal assessment of where our shortfalls exist and really focus and devote time to those areas that we think, we need to devote the most time, but we just really are going to struggle to meet this deadline. And that's the hardest part of this. It's not that we don't think it's positive. I think it's a really great positive move towards the future to hold all providers to performance-based standards. I think it will improve in a better system of care, but it's just really the timeline.
Yeah, Gian, I know you've been involved directly as well as others on committees and things with the deputy secretary. Maybe some other insights into the tiers or other things that concern you about your organization as you move forward, or even any provider as they move forward in PA under this model.
Thanks, Bob. I would say that the 30,000-foot view of this, it represents a paradigm shift from being judged by the lowest common denominator, i.e. licensing, to being judged on a higher set of standards, both set by the state or the Commonwealth in our area and vis-a-vis your peer group. So making sure that we're not quite as far ahead as Jody. I think we came on about a year after Mainstay did, but we had a fundamental system set in place so that when the actual performance standards drop, and we don't know what they are yet, we know this is the rough draft. We're fingers crossed we'll have that information by the end of this month. We'll be ready to pivot with the data that we have. And immediately start to make sure that we're doing our stoplight checks. Red, we're not there at all. Yellow, we're on our way. Green, we're ready to go. So we're excited.
That's awesome. So, as you can see, the performance contracts are emphasizing the quality, compliance, and workforce and the KPIs. Scott's got some interesting history here because can you share your experience, Scott, in helping to define actually these measures for Medicare when they transition hospitals from fee-for-service to value-based, and then how the BI Collaborative helps human service providers think about defining quality as well?
Yeah, sure. So the whole concept of value-based reimbursement started through some work out of Harvard by an individual by the name of Michael Porter, and he wrote a book called Redefining Healthcare. It's like a War and Peace book, so it's a really thick book, but it is the genesis of where we are today. And as they started to think about healthcare, one of the main concepts is it can't be a zero-sum game, meaning you can't push healthcare costs from the payer to the provider, or the provider to the payer, or to different parts of the healthcare system. We have to remove inefficiency out of the system, and so that's where the concept of value came. So there was a lot of emphasis that was put on how do we define value, how do we define quality, and so it started in the physical health side with very basic measures of infection rates, mortality rates, and then went to the HEDIS measures that exist today that are more procedural based to say, do X by a certain time or do Y by a certain time. But as we started to work with hospitals, and as that managed care and pay for performance and value-based got more mature, we broke it into different sections, and we used these 5 dimensions of quality: health and safety measures, human capital measures, customer service measures, key operational business processes that are relevant to quality, and then probably the most complex are health outcome measures. That transformation and is still going on in physical health, and took decades. That's the kind of maybe the bad news. And the worst news is we're going to go down the same path. We're going to go down it a lot faster because the path's been kind of laid a little bit. But as we started to do that again, we looked at it in different dimensions. And as you think about your quality, and if you look at even what the state of Pennsylvania did, they have in there customer service measures, they have in there key operational measures, and they start talking about outcomes of how are you tracking goals and progression towards goals for individuals being served. So when you think about quality, you think about it in a more holistic approach. So
that's awesome. And thanks for stealing my Matthew McConaughey transition that I worked in here, because I think he said it best in his commercial, right? So if AI is the Wild West, does that make data the new gold? Yes, Matthew, it does. So GN, what were some of your biggest data reporting challenges before working with BI Collaborative, or what kept you up at night?
Sure. Well, our organization is spread across 11 counties in the Commonwealth. We have 3 offices. I always say we're a mile wide and an inch deep. And when that occurs, you have some natural siloing. Just from an organizational standpoint, people tend to stay within their areas. And then when you add different platforms, a different fiscal platform, a different EHR, it's really difficult to get people on the same page. And when I reached out to the BI Collaborative in, I believe, 2020, my biggest concern was that we had developed a culture of information hoarding, almost, that information became power in different departments and things were being siloed. And it made it very difficult to make key decisions across the organization. And it was also culturally keeping people separated. And when you throw in COVID at the time, it made it even more so. So that was our biggest concern and why we reached out to you guys.
And Jody, what were some of your challenges, 2-3 years ago before you started down a real disciplined path to being data driven?
As a CFO in the past, I had the experience of closing programs at different times, and that really stuck with me because I felt that those were programs that, had we had the right data, had we understood the cost of our services, had we been able to go back to the funder and have a conversation with real data, that we might have changed the outcome. And so that, years ago, early in my career, stuck with me. And so I was really determined to have the data and the information so that I was never put in that situation again, so that we were able to make concrete decisions, or at least advocate for what we needed.
That's awesome. We'll look forward to hearing a little bit about how that's changed over time later on. But thanks for that insight, Jody. So, Scott, another key concept is this idea of enterprise business intelligence. So, can you really lay the foundation and speak to how the BI Collaborative pulls data from disparate systems and helps to create performance reporting insights that really you can't get using just data from a single source?
yeah, sure. So as you think about this journey, I think GN kind of hit a key point. And you look on the left side of this slide, you'll see your source systems that typically exist within a provider. You have finance system, EHR, payroll, the quality system, the HR system, learning management system. So you have these very disparate systems that exist within the organization. And the data stays siloed with those systems, and the individuals that understand those systems and can either pull data out of those systems through the form of a report or an Excel file, right? So the concept of enterprise business intelligence is, how do we pull all that data into a central place and connect data through? There are 3 main hierarchical threads that go through an organization. One is your programmatic infrastructure that starts with a service line. Each service lines have different programs. Different programs have different locations. And then you have the individuals that you serve, and they may be in multiple programs and sit in different systems. So you want to make sure that they have unique identifiers to be able to aggregate that data. And then it also includes staff. And so how do you link staff within different systems? But when you pull it into this central management or data warehouse or data lake, you can combine that through those hierarchies that I just referenced. So a great example is I want to look at productivity. I want to look at build time out of my EHR, which is typically done through the EHR, and my paid time, which is typically done through the payroll system. And then I can get insights into productivity. But as you start to pull all those different pieces together and combine that information, that's truly where you gain insights to information and parts of the organization that are critical that you can't do unless you combine that. And then from an enterprise standpoint, the technology today is very robust. There's a number of different BI tools. We use Power BI from Microsoft because it plays well with all the Microsoft other software, but it sits on top of that and creates and gives you access from anywhere. So it's an
Awesome.
overview, Bob.
And Scott, maybe can you share 2 examples of pulling data from different systems that actually helps deliver deeper insights?
I think the next slide is a great one. So in the state of Pennsylvania, the HRST, the health risk screening tool, it's from Intellectability. They did a great research study in the Georgia, I think it was the Georgia Nursing Journal. And so it is a predictive tool of the Fatal 5. And then they also have fall risk and GERD risk as well. So it's that tool has 22 elements that you see in that line chart up above there, and like on the right side, and it has the scoring for those 22 elements, and then on those, the scoring of those roll up into an overall healthcare level score, an HCL score. So it begins to give you the very basic beginning of a risk stratification process. However, if you can combine that data with needs group data, and as shown in this chart down on the bottom are incidents, you start to get a further, we'll say, window into an individual. And as you go down managed care and pay for performance and value-based, risk stratification is a cornerstone because you have to understand the acuity levels, because it's like the 80-20 rule. 20% of the individuals will result in 80% of your cost consumption and 80% of negative things. For example, that it's de-identified, but the ID 11781, this is a view of that individual. They have all 7 risk factors as outlined in HRST. You can see from the lines that their acuity level is increasing, and you can see the incidents that have occurred from that. Now, within the state of Pennsylvania, not only do they want to make sure that you're using the HRST, and when I say using, I mean doing the assessment and scoring on a regimented basis. They also want to know how you're using that information to prevent Fatal 5 incidents from occurring. And so this is where that combination becomes very powerful. This then taken to a multidisciplinary team of clinical folks, of operational folks, of quality folks. You start to then map out processes and we'll say more, I don't want to say evidence-based because our industry lacks evidence-based protocols, but more, we'll say, sophisticated ways of treating complex individuals.
That's a great quality example, Scott. How about an operational example of data from disparate systems?
So this one is it's a little bit more complex, but it's an important point. This shows profitability month over month for different residential facilities shown on the left there. And in that, profitability is what's known as a lag indicator. It's something that you measure to understand performance. To improve lag indicators, you have to understand what the lead indicators are. What are the things that drive profitability? Because it's those lead indicators where you can take action. It's where you can drive things. It's where you can create initiatives. It's where you can do education to help people change things. In this one report, it's the overview is just a summary here that shows this, and you can see on the far right, it's from worst performing to best performing, and then through the use of the technology, you can do what's called a drill through. You can click on that cost center. Bob's hovering over at 223015. It'll take you to the detail of that cost center. In this detail, it shows you a little table on the right there. It has month over month, their profitability again, their revenue information, salary and wages information. If that salary and wages goes over 70% of revenue, it gets highlighted. It shows you the census of the facility and the capacity, because as in many providers, that can change from one month to the next. Based on that, in this example, the provider created targets for each of the different facility capacity homes and each level of needs group combination within those capacity thresholds, and came up with revenue, salary and wage, and salary hours, and salary rate targets. That could be a target. This is based off of a break-even target, but it could be a budget target. It could be a target for whatever you want. And then the variance analysis is shown to say, okay, how are we performing to those? Where are we really, because we're not performing well in this specific cost center or facility, where is it? You can see there's a negative variance of $15,000 related to revenue. Well, what drives revenue? Well, the first piece is there any vacancy? You can see down in that chart where it says occupancy, there's all zeros across for vacant. So there was no vacancy. However, when you look at the therapeutic and medical leave, you can see that there are individuals were out of the home. That loss of revenue equated to almost $27,000. So there was part of why the revenues were off. Then as you go into the expense side, salary and wages make up typically 80%. You can see that they were over. If you go back up to that prior slide, 1 second, Bob. You can see that the expenses were over by 74 grand. However, the interesting part in this, the labor hours were below target. So from the amount of hours that were there, you were fine. It's the labor rate that was way above where your target was for this specific type of home. Then you can go to the next slide, please, Bob. Thanks. One of the key things that drives labor rate is open positions. So you can see there was an open position. That then typically leads to overtime or premium pay. You can see on this, 49% of the pay was premium, 51% was regular. And then down below, you start to get insights into individuals, and those would be actual individuals, right? The number of hours they spent per month per home. And so you now start to look at the lead indicators of what's driving the expense side of the equation. But I can tell you there's, within this one view, there's data from 4 different systems being pulled and aggregated in.
Awesome. Great example. So GN, love to hear from your perspective. What can you do today that you couldn't do before, and where you got a lot of value?
Well, Scott detailed a lot of what we do on a regular basis with his demonstration. This is an example of our P&L. We will monthly sit with our operations directors, our area supervisors, and drill down profit and loss centers. We'll take a look at things like overtime improvement, number of leave days. Another thing that we have now access to, we're self-insured. So we have an entire dashboard for our insurance, because oftentimes we see when you're self-insured, there's a large wave of cost differentials, and we're able to capture that and see if it's going to be a long-term or short-term cost change. So it's a really important piece of information that we use often. This next slide is our health tracking system. This helps us eliminate what I call unforced errors. These are things like missing a physical or an annual, like a TB test, things like that, that sometimes get lost in the miasma of a day-to-day work environment inside of a group home, right? So this allows us to take a look. There's highlighted information, red and yellow for days since the last appointment was completed, so that we know, in the next 30 days, your physical's due. we'll reach out and contact the frontline supervisor to ensure that's been completed. And it helps us it's another function of quality assurance that we use.
And Jody, I guess same question. What did you focus on, and where did you see some of your biggest value examples?
So part of what we had happen was right as the pandemic was starting, we were looking at all of our financial information on a monthly basis. And when the pandemic started, like everyone, we had no idea what was going to happen. But I did know that I was going to need data and I was going to need it faster than ever. So understanding that the bill data was being entered in the electronic health record daily, time punches in the payroll system daily, that I knew the data was there. And the question became, can we get at it faster? And so we did. We were able to pull together weekly reports. So for our organization, we can see the number of individuals served, bill units, productivity. We're able to monitor progress on a weekly basis. And so we've been doing that now for 4 years, and we'll never go back. That's a new expectation. And I challenge, can we get better than that? So that was a great improvement that we never expected. And it also helped us manage through the pandemic because we did need to shift people from community-based programs to fill residential gaps and vice versa. So this gave us the insight that we needed to keep our organization where we needed it to be.
So I noticed you have productivity as a subchart here on your weekly report. Maybe there's more detail there that you're interested in sharing.
Yeah, productivity in a fee-for-service environment, this was always so critical to me. I always believed that you could get to a system of pay for performance, that you could offer incentives to employees for reaching productivity targets. And so I was interested in having that information for that reason. And the secondary reason was knowing the right time to add staff. So there was always a discussion between program and finance where the program staff believed it was time to add another position, not really understanding the productivity. You might have 25 on your caseload, but are you billing for all 25? And so having the bill data, the authorizations, all of our information in this system and being able to see it transparently. So program and finance are looking at the exact same information at the exact same time. The answer becomes very easy. It's a conversation that we can both see the same numbers and we're able to effectively come to an agreement when it's the right time to add staff.
That's great. Those are just some great reporting examples. Jody, you just actually started to hit on some of the cultural change that goes along or came along with this, right? So maybe I'll just stick with you. Can you talk a little bit about, the impact of some of those cultural changes, both some of the challenges and then some of the results, quite frankly?
Yeah, there were 3 really big changes that came about with our organization with the implementation of this. The first was we do have an incentive plan that we've now offered. We started at the highest level of our organization, and we've got it down to about mid-management right now. And our goal is to continue that incentive plan throughout our organization down to the frontline managers. What that is based on the data and the goals that we set, they're compensated for achieving those goals. And that was done in conjunction with compensation consultants and using the data. So it was done in a very planful way, but that's had major impact in our organization. The other 2 things that we did was we started what is called a leadership training series. So any new manager that comes into our organization goes through an 8-week course, and it's about 4 hours a week that introduces them to the leadership style and qualities at our organization. So it gives you some basics that every supervisor needs from an HR perspective and the things for the position, but it also gets into data management and how our expectations are for our organization as far as managing with data and BI. The last piece, the last point I'll make, Bob, is the regular operations reviews. So that was the other big impact and change for our organization. there's no longer the wait for the information to be shared, for program to assess, and then for meetings to get scheduled. We have these operations reviewed scheduled where the expectation is that program and leaders have reviewed their data and they come to these planned meetings prepared with solutions and discussion points about what the data shows, because we all have access to the data. We've already seen the data, and it's time to sit down at the table and figure out what the solutions or what the next steps are and what that data tells us. So those are three really big changes that happened at our organization.
Yeah, I think I heard you present at an Open Minds event that in these meetings, the staff is not afraid of the BI. They've embraced it, and now they're using it to do the justification for their request when they come to leadership. So that's amazing. GN, did some of the, I guess, experiences that you saw in your organization that either, just can be shared or that actually maybe even surprised you?
Well, it's funny. I did not know that Jody was doing that with her organization, but we're doing it in the exact opposite. Where our frontline supervisors are evaluated on about 10 KPIs across various platforms, things like overtime improvement, citation data, how challenging the home is based on a support intensity scale, and we bonus them out in the same way. They're evaluated by region. And so that's been obviously we had started doing that before BI, but that was with much labor and wailing and gnashing of teeth by my QM people. So that's been a huge benefit. The biggest change, I think, is the democratization of the data, that people now all have access to it. There's a lot less informational siloing, a lot less hoarding of information. It's a much more communal atmosphere when it comes to deciding what changes we're gonna make, because no one feels like they're being kept in the dark. So that's been a big benefit. And then we've also utilized it with board presentations. And it's much easier to explain to your board what you're doing with charts than it is kind of sleight of hand. So it's been a big help keeping board relations probably optimal.
Great. I heard you make the point there, and I'm going to ask you to maybe expand on it, but you talked about how the manual effort to actually create some of that reporting in the past. Maybe if you could speak to just, aggregately how that's changed or transitioned, from manual efforts to automation, and maybe creating a single source of truth, if you could speak to that.
Sure. We have one in-house IT person and about 3 quality management folks that were just using page after page after page of Excel spreadsheets and manually entering the data. And they were, God bless them. I kind of had an idea of what I wanted to do, and they were doing it, but it was really labor intensive. So switching that from a 3 or 4 day evolution at the close of every month to just a quick data pull, or a call up of a dashboard, boy, that makes a huge difference.
Awesome, thanks. Scott, you've seen so many different providers and been through so many of these journeys and transitions. If there's something that maybe wasn't covered you think is important, but also maybe speak to some of the success factors that we didn't really speak to in these reports, like maybe data governance, data literacy, and change management that are critical. We know are critical to the success of these journeys.
Yeah, I think you hit the good ones, Bob. So, the first one, I mean, there's a number of providers that we work with that already have a BI team. And as we assess and we'll say engage in those partnerships, one of the common threads that we've learned is many times people will create the reporting in a silo. And then they'll put it out there and say, okay, the report's there. And then they get frustrated because no one's using the report. And so if you're going to drive a technology change through the organization, having a change management plan that accompanies that is absolutely critical. And the key of that is communication of what you're doing, why it's important, and where you're going with it. And also one of the benefits that it is to the individuals that are involved in the change, and that is, I don't have to do these manual Excel sheets anymore. That's going to go away. People get excited about that. So that's one. If you're going to go down the path, don't do it in a silo or in a box. Engage key stakeholders. Have them feel like they own part of it. They're part of the process, and they're moving it along. Two, Jan and Jody hit on absolutely key points of a form of data governance and data literacy, because people within human services, many don't have a finance background, many don't have a technology background. So now you're going to give them data. You can't expect them to just flip a switch and they understand it all. There's education and training. Jody referenced hers. I know GN sits with his directors and they go through the data together as a learning part in the beginning. And so there has to be a data literacy initiative so that people understand it and so that they're not intimidated by it. And so that's absolutely critical. And then the third piece is that data governance. And it kind of goes back to the first piece too, right? So when you're going to go down this initiative, and this is not a nice to have, this is a must to have given the context of our discussion today with value-based. But as you do that, you don't want one part of the organization, whether it's IT or whoever heads it, you don't want one part shouldering all this. A data governance team should be a multidisciplinary team of all the key service lines of the organization and all the key support areas, finance, HR, and that team should be the decision-making of policies and procedures, decision-making of a number of things that you're going to need to be able to address the market and to address your own needs. So data governance becomes a key part. And I can tell you, I have not found one provider yet that had a full-blown data governance structure when we started working with them. So just a point.
That's great. And then to sort of wrap this, Jody, maybe what investments, whether people, technology, et cetera, did you make or not have to make based on, how you pursued this journey?
We didn't make any people investments. We did make systems investments. And when I say systems, this process forces you to look at where your data is kept and how it's stored. And so there were very simple changes in our electronic health record where we just had to standardize where things were put or how they were put in. And then we had a much bigger project where we discovered most of our HR department was still paper-based. And so in order to get the data out that we needed, we ended up doing a full RFP and switching payroll and HR systems to get what we needed to be electronic and to get into the BI system. So it can be a really small investment or a larger, depending. I wouldn't be afraid of it, though, because at the end of the day, it really helps you get where you need to be anyway.
Awesome. So that brings us to the end. We're going to wrap it here with just sort of an understanding at a detailed level of the platform. Scott, I'm going to ask you to jump over to the chat and see where we are with Q&A, and encourage anyone that has a question, get it out there to the chat, and then we'll get through that here after this final slide. So, just going back to a little bit of more detail about, our platform. The platform has hundreds of interactive dashboards that are organized into what we call modules, and those modules serve different functional areas. So those modules are then organized into the categories that you see here of financial operations, HR training, quality compliance, and then collectively they deliver performance reporting in a balanced scorecard approach. Our business model is equally as simple. You don't purchase the whole platform, but you select modules that deliver the most value to you. We typically implement 3 modules in parallel over a 16-week period. The pricing is also simple. There's a one-time setup or implementation fee. It's $6,500 per module. That pays to automate getting the data from whatever the data source is, and also to create the reporting. And then once that's created, there's a monthly subscription fee per module for anyone in the organization to access that reporting based on permissions. And then that fee is $250 per month if your annual revenue is under 70 million, or $375 a month if you're over 70 million. So it really is that simple. It's this comprehensive, and it's a journey, right? And at the end of this journey, what you actually get is a single source of truth that's organized into a balanced reporting scorecard at both an organizational and a programmatic level. So with that, let's get to the juicy part, right? This is what we wanted to do. Create some interactivity with your colleagues. Scott, anything in the chat that we can start with?
Well, yeah, there was one from Laura. She said, is there a feature or an example report that effectively uses storytelling to present both qualitative and quantitative data in an easy, digestible format for various audiences? Additionally, can these reports be configured or sent automatically? So the first question, Laura, is probably one of the I'm ashamed of it, but I'm going to be vulnerable right now, Laura. And Jody lived this with me, so she knows exactly what I'm talking about. You know, though, as a technologist, you want to give everything you have, so you create too much, and you make it too complex. So simplifying is something that took us time to learn. You use the same data at various levels of the organization, but you create different ways that end user can consume it. So the board or executive level is a very summary level. Middle management is a little bit more detailed. And then, you know, for frontline staff in certain areas of like exception reporting, to make sure they have notes, or to make sure you're tracking bowel movements or calorie counts or whatever, it's very detailed oriented. So being able to use the same data to create different ways, whether it be a story or just a simple chart, is very powerful. And can the reports configure to send automatically? Yes. We use, I referenced in the beginning, we use Power BI as the visualization tool. That has a subscription service that sits within it that you can send information hourly, daily, monthly, quarterly, and you can set the times and you can set the audience to receive that. And for a lot of providers that are typically larger providers, instead of giving everyone a Power BI license, you can send out a PDF of a report, and they're only looking at one or two things, and so you can simplify it that way and send it on an automated way. And that automation can either be sent as an email, or it can be sent to like a SharePoint site, and people can just go to the SharePoint site and digest it.
Awesome. Are there others? If you want to check the chat, and then as you do that, I want to remind everyone that Donna is still here from ANCOR. So if there's questions related to, you know, states or transitions, include those as well, please.
Max, did I miss any? I'll go ahead.
Oh,
I'm sorry.
I'm sorry. I wanted to
Donna.
ask if I could jump in. What I wanted to just offer is that while these systems, I think, are really, really helpful for providers just sort of managing their organization and the array of services they provide on a day-to-day basis, and it's really like just sound business practice. The thing to keep in mind is if and when your state is moving into some sort of a managed long-term supports and services plan, the need for this data becomes paramount. You know, where it may be good practice today, it's essential tomorrow. It's essential in that sort of environment. So as organizations, you know, are thinking about making an investment in some sort of a system, it's really heightened if your state is looking at moving toward value-based purchasing or some other payment methodology that really relies on quality outcomes, and you need the hard data to support that.
Yeah, and I'll piggyback on that, Donna. I mean, I think, we also do data-driven assessments, and so organizations will invite us in to say, tell us where we are, and it's in essence a sophisticated gap analysis that says, here's where you are, here's where you should be as a data-driven provider. And as we go into those, we've been in a couple where portions of the organization were not in an EHR or on paper. We see that a lot in citation management on paper. A lot of, again, they had EHRs. There were no EHRs. They were on paper. As you think about this, if you have major portions of your services that are on paper, I would warn you to think heavily about moving as quickly as you possibly can to do that. Now, a comment of that, and Bob and I have learned this through talking to a lot of people. We haven't found anybody that liked their EHR. So everybody hates their EHR. So we've been trying to figure that one out, and I think a part of it is EHRs aren't great in the implementation, and I think the education of the provider to understand what resources and the provider needs to have as far as expertise of the EHR, how to use the EHR, how to modify the EHR, and just as importantly, how to get data out of the EHR typically don't exist. And so many of those implementations are suboptimal. So be careful of that as you go down that path, but it's an absolute critical component. And I'll go back to the comment of, Michael Porter and the whole change to value-based. One of the keys and cornerstones was to digitize the U.S. healthcare system. And so hospitals were paid to, that's where Epic and Cerner got so big, because it was a mandate that hospitals put EHRs in place. And you do that so you can have the data so that we can understand and manage. But so if you're not on that path, please, I urge you to begin that path.
Any others? I tried to flip back, or have we hit all the questions? Looks like we have. Well, with that, I really hope we had so many conversations at Anchor last week. I see Max. There's one more.
How does your tool leverage AI, if at all? We use AI and I'm going to say in a very rudimentary way right now. And so it's probably not even worth speaking about. However, Microsoft does have what's called Copilot. Copilot is available with Power BI and can team up with it, but I would urge being cautious with that as well. It's out there. It does some analytics or assisted analytics with information, but it's got a little ways to go.
Yeah, I'll just share that there was a session actually, Donna, at Anchor, and I believe, I don't know if you were in it or not, but Stacy DeStefano, and there was a lawyer from a law firm that specialized in HIPAA, and they went through. So I would encourage anybody that's looking at the implementation of AI. It has so much upside, and I'll just share the experience Scott and I have. We've been on leadership teams at a couple different companies. One of those companies was building human avatars with machine learning, AI, and natural language processing. So that's in our history. That'll be in our product roadmap going forward, leveraging obviously those technologies. But I just want to throw out, it was educational for me. The lawyer scared the crap out of everybody in the room, right? As she probably should. But it's there needs to be discipline around that because there is huge upside, but certainly some risk associated. So just the word again of due diligence related to that. That's great. I just want to thank everybody for joining us. Our intent was to really hopefully create a lot of educational insight here, opportunities to talk to your peers, to subject matter experts like Donna. So Donna, thank you for joining us. Jody and GN, thank you for your time. And everybody here, thank you for attending. You had my contact information on the screen before, so please reach out, visit our website, and if we can help you, we would love to do that. So thanks everyone and have a great afternoon.
Thanks, everyone.